in the week. So welcome to the MCCC Health Professions Introduction. And here is our speaker for tonight, Dr. Liz Mizarek. Thank you so much.
Good evening. We're so happy that you could join us to talk about the health professions programs here at Mercer. So I am Liz Mizarek, and I am the Dean of Health Professions. And with me also is Dr. Nicole Killian, who is the Assistant Dean over in the Health Professions Division. So let's get right into it. Our health professions at a glance. So we have several programs that are what we consider direct to job degrees. So these programs, once you complete them here at Mercer, you are eligible for some credentialing that allows you to directly enter the workforce right with your associate's degree. And so the four primary programs we have: medical lab technology, nursing, physical therapist assistant, and radiography program. We also have a program in partnership with Brookdale for respiratory care therapist. We also have a couple of other options. We have two certificate programs, and the difference between a degree and a certificate programs typically are 30 credits and can be completed within a year, as opposed to a degree program, which are usually around 60 credits and usually will take about 2 years. Then we have, so our two certificate programs are medical lab assistant and medical office assistant. We have three other degrees that are considered transfer degrees. So you would receive your associates here and then with intent to take them to a four-year school to continue your education. And those degrees are exercise science, health science, and public health. So let's jump in with medical lab technology. So medical lab technology is a great and evolving field that really allows you to contribute to the healthcare environment, but usually in a less direct patient care way. There are components of the field that are direct patient care, but most of the work that our medical lab technologists do is behind the scenes in the lab. So MLTs use a lot of really sophisticated equipment and clinical judgment and different methodology to do the behind the scenes testing that's necessary for members of the healthcare team to make decisions about people's health and wellness. So it's estimated that up to 70% of clinical decision makings come from the work that's done by MLTs. MLTs work in a variety of settings, a lot of hospitals and clinics, diagnostic laboratories, outpatient laboratories, blood bank, research facilities, and more. So the core coursework, it takes place over 3 semesters, summer, fall, and spring. And the core coursework is going to delve into each of the different areas that MLTs typically work in, including chemistry, hematology, microbiology. It does include clinical practice, which is about 560 hours of direct practice in a healthcare organization doing the work of medical lab technologists. So with our four core programs, there is a separate application process. So after you've applied to Mercer, you can begin studying. You can take your general education courses, your English, your math, your science courses. But there'll be a second phase of an application process to begin what we typically refer to as the professional phase coursework. And so the MLT application process requires that you have a cumulative Mercer GPA of 2.5 or higher, a C+ in all the science courses within 2 attempts in the last 5 years. They accept applications during the month of February, and the cohort starts in the summer. It is a selective program, and about 30 students are accepted each year based on their capacity. Moving on to nursing education. Nursing education is a program that allows our graduates to sit for NCLEX, that's the licensure examination for nurses, and allows them to obtain a license as an RN or a registered nurse. Most people are pretty familiar with what nurses do, but just as a quick overview, nurses do things like perform physical exams, take health histories, provide health education, administer medications and personalized treatment, coordinate care, and supervise care delivered by other healthcare personnel. Nurses work in all kinds of settings. You can find nurses in virtually every sector of the healthcare environment and even out in the community. So the nursing core coursework includes lectures, labs, and clinical rotations. Every semester of the nursing program includes a component of direct patient care. The coursework includes professional nursing, the concepts of nursing practice courses, which are the core courses, as well as a transition to practice course. The application process, there are 2 application periods, the month of September for the fall and March 15th to April 15th. We accept applications for students starting in the fall, and September 1st to October 1st, we accept applications for students to begin the professional phase in the spring semester. Students, we take about 50 students in each application, so 50 students twice a year. You have to attend a nursing information session. Those are held regularly. There's at least one session per month, usually more than one. We ask you to take a test of essential academic skills, or a TEAS test. They have to have a C+ in all science courses in the past 10 years. And this, again, is a competitive process for selection of students. Onto our physical therapist assistant program. A physical therapist assistant is somebody who works closely supporting licensed physical therapists by delivering physical therapy services. And this is provided to people of all ages, either with medical conditions or other kind of health-related limitations of mobility. Think about people who have had a surgery or who are recovering from some kind of injury. So PTAs are working directly under the supervision of a licensed physical therapist. And they work in a variety of settings, think hospitals, rehabilitation centers, nursing homes, even schools employ PTAs to work with different populations. So the core coursework for a PTA includes things like clinical orthopedics, applied kinesiology, physical agents, motor development. There is a pretty significant amount of clinical education, over 400 hours, again, doing direct patient care kind of activities. In order to apply for the physical therapist assistant, you have to complete all the prerequisite courses, again, looking for a cumulative GPA of 2.5 or above. They also have an information session. Their information session is online, and applications are accepted during the month of April. About 28 students are accepted based on capacity, and again, it is a competitive process. The radiography program. Radiography is a field in which the technicians are going to use imaging equipment to capture the detailed images of the internal structures of your body. In addition, they may work with others to prepare patients for procedures, make sure the images are taken, and work closely with the radiologist to help diagnose different conditions. Again, can work in hospitals, imaging centers, physician's office, urgent care, research facilities, and many other places where x-rays are taking place. The program coursework, again, has lectures, labs, and clinical rotations. You're seeing a theme here. All of these are direct patient care, so you're going to have that clinical component. So they have introduction to radiography, they have advanced imaging modalities, introduction to pathology, lots of clinical experience in this program as well. The application process for radiography, you're going to, again, need that cumulative GPA of 2.5 or above, C+ or above in the science and math courses in the last 5 years. They accept applications during the month of February, and about 30 students are accepted annually based on that capacity again. And it is a competitive point system. Now, switching out of the application-based programs into some of our transfer programs, we do have a public health degree, and public health allows you to work in the area, in many different areas. An associate's degree allows you to practice in as a health educator, a public health assistant, or a community health worker. And a public health degree is really a very broad-based degree. So you have coursework both in sciences, the social sciences, and health. And again, this is for intended to transfer to a four-year program to either continue for a bachelor's degree in public health or emergency preparedness or other options related to the field of public health. So some of the core courses that you'll find in the public health program are obviously principles of public health, disparities in individual and community well-being, introduction to sustainability, foundations of community health worker practice. So again, you're going to get sort of a broad-based education within the healthcare community. And sort of the difference between our application-based programs that are more focused on providing care to individuals and families. In public health, you're really concerned with providing care for communities and populations of people. So it's different. And it's not to say a community health worker doesn't work one-on-one with an individual, but the goal of public health is more focused on increasing the overall wellness in a community. Moving on to exercise science. Exercise science prepares people for careers in coaching, education, health promotion, personal training, athletic performance, those kind of career fields. Our graduates are eligible for strength and conditioning certified personal trainer exam, and you may continue on again to a four-year program, either to continue with exercise science, perhaps look at athletic training and other programs related to the field. So some of the exercise science core courses include things like prevention, assessment, and care of athletic injuries, principles of coaching, nutrition, and exercise science also does include a field experience as well. So going out into the community and putting into practice what you've learned in your coursework. I mentioned earlier that we do also have an affiliation with Brookdale for our respiratory care program. So the respiratory care program at Brookdale makes you eligible for licensure as a registered respiratory therapist or an RIT. What respiratory therapists do is they work with people who have breathing difficulties or cardiopulmonary difficulties by doing things like assessing lung function, administering treatments, oxygen therapy, ventilator support, lots of education for the patients on managing their conditions. They work in hospitals, clinics. Home care is very important because a lot of patients do go home and need ongoing support as well. So for this program, you're going to take your general education courses at Mercer, but then you'll transfer to Brookdale to do the professional phase of the respiratory therapy courses. So some of the requirements that Brookdale has is to shadow a respiratory care therapist, take that TEAS test. Remember, that's the test of essential academic skills, and attend an information session at Brookdale, which they hold in October or March. Closing out with our medical lab assistant and our medical office assistant. These, again, are the certificate programs of proficiency. They are one-year programs that allow you to get some education and transition very quickly into the workforce. But also, these programs are built for you to be able to continue on your studies. So, for example, the medical lab assistant, the jobs here can include phlebotomist, a clinical laboratory assistant, somebody who does specimen processing. You're eligible to apply for the certification exam for phlebotomist. And this program is really geared for students to come back and continue in our medical lab technology program. The medical office assistant, as you can imagine, there's a lot of needs within a medical office to do things like billing and coding and medical office assistant. And so that program makes you eligible for some of our professional exams as well. So what are your next steps? The first step for all the new students is to talk about that first semester coursework. So one of the wonderful things about this is it doesn't matter if you're not entirely sure which of the health profession programs you're most interested in. You need to think about it, do some research, maybe look around, talk to some folks. That's okay because for this first semester, everyone is taking the same exact coursework regardless of what program. So that first semester coursework is English composition, elementary statistics, the first half of anatomy and physiology, introduction to psychology, and college success and wellness. So if you have any questions at all, that's the place to start is with those core courses. In the second semester, before you register before the second semester, you'll have to have a better idea of which program you're interested in because, for example, if you were to take nursing, you would want to take chemistry, but if you were interested in the radiography program, you might take physics instead. So the programs do start to diverge a little bit in the second semester. We also encourage you to attend program-specific information sessions. Again, nursing has an information session. The PTA program has a specific information session. All of our programs have their own website and they are filled with information. So if you go to the main Mercer webpage, mccc.edu, and click on the link for academic programs and scroll down to find the programs that you're interested in and check out their web pages because all the information that I presented tonight and way more information is listed there as well as the program coordinator contact information. So that's going to be the next step once you've decided what program or you're seeking more information to help you make your decision. Talk to the program coordinator because they can give you the very specific information about the field in which they study. All of the program coordinators are experts in their field. All the nursing courses are taught by nurses. The medical lab technologist program coordinator is an actively practicing professional in medical laboratory sciences. All the folks in the radiography program are radiology technicians. So we all have the expertise in the different areas that will allow us to speak to any concerns that you may have or questions you may have about the field. So that's all I've got for you tonight, and I'm happy to open up the floor to any questions anybody might have.
I don't see any questions in the chat. I did sometime if you would like to be connected to the health professions department, if you want to just include your email on there and your last name, if you don't have it in the chat, I can send that along to health professions. While you're thinking of any questions, I am going to just share a quick survey that you could fill out for us afterwards. But if you have some questions, we can sit for a second and see if you have any in the chat or if you want to unmute yourself and ask your question. We got a quiet bunch tonight.
That's okay. I know it's a lot of information all at once, but I just like to give that overview for folks so people understand that we've got a number of different health professions. And I had a couple news reports come across my desk recently. The healthcare industry is one of the fastest growing industries in the workforce. And so the employment prospects are wonderful. All of our professional phase programs are enjoying 100% employment rate, meaning that our graduates, once they graduate, they get licensed. 100% of them who are looking for a job have gotten a job, and they are getting jobs in really cool areas and places that are unique and unusual. And everyone's been really happy with their placements. So it's a good industry.
That is wonderful. Okay. Last chance. Anybody have a last question? Great. Well, thank you so much for coming out tonight to learn more about health professions. I absolutely will connect you. I do have some information to pass along to the health professions staff here with your information. I will send that along to them. Thank you so much, Dr. Mizrek, for presenting tonight. We appreciate this. This will be again, if you want to go look at this again, if you didn't catch everything and you want to go back on it, we will have this up on the YouTube page by tomorrow morning. So thank you so much, everyone, and we'll have a good night.
You too. Thank you.